Georgia Governor Brian Kemp says they're putting $100 million towards helping staff healthcare workers across the state. That could help hire up to 1,000 more people for 13 weeks. Additionally, Kemp says they're getting ready to deploy 200 National Guard members next month to help at testing sites in hospitals. He says we have to work together.
For my fellow Georgians, we've gotten through this before. We'll absolutely do it again. We're all in this together. We will work diligently to provide aid and cut down on people's wait times at testing locations, but we want to urge Georgians to be patient and be compassionate to your fellow neighbors and citizens.
U.S. COVID cases rising to a pandemic high as Delta and Omicron circulate at the same time. Check out this chart from Johns Hopkins. You can see the previous peak of new daily cases in January of this year. And since the Omicron variant really took off, there's a near vertical rise in daily new cases. Our Kennedy Harris takes a look at how this national trend is reflected here locally.
Between the hospital and university's prompt cares, they've been testing several hundreds of people daily, and doctors don't know yet if these cases are Delta or Omicron. University Hospital says the number of COVID patients has doubled since this time last week, and the number of cases, well, that's increasing even faster. In total last week, they had about 400 positive COVID tests from both the hospital or their prompt care sites combined. This week, in just 3 days, they've already reached around that same number. Chief Medical Officer Barry Jenkins says the increase in testing they see is likely related to asymptomatic people trying to be cautious after gathering for the holidays, but also just so many more people showing COVID symptoms. Even though there are more tests available now than ever before in the pandemic, they're still overwhelmed trying to meet the current demand.
We have access to much more testing supplies than we did a year ago, so that's fortunate. But we are running into supply chain issues with some of the rapid tests and some of those things, so it's not like we have sort of an endless supply.
Well, by now we've seen several COVID surges, but there's one thing about this increase that makes it different. It has doctors worried and unable to predict what might happen next. I'm working on that story for News 12 at 6 o'clock. Reporting from Evans, Kennedy Harris on your side.
Georgia and South Carolina, both among the 10 states that have seen the most people die from COVID this year. That's according to Johns Hopkins data. Health experts say they've seen more death this year, much more severe COVID in children, and still very low vaccine rates. Over at MUSC, all the kids who've been in the ICU are unvaccinated, while about half were eligible to get the shot. When these children do recover, sometimes they don't know who will be picking them up.
Sometimes we'll have a child in the hospital for COVID, and then there's no one to discharge them to because, unfortunately, one or both parents or their caregivers have died. This is something that we really haven't seen before. So even if they medically are well, socially, we have to sort out that piece, which has really been heartbreaking.
She says people shouldn't assume treatments like monoclonal antibodies will be available and effective if they get severely sick from COVID. Well, taking a live look over I-20,
upper 60s, much more on those storms coming up in just a few minutes, Will.
Thanks for that, Anthony. Record-breaking COVID cases in Georgia for the second day in a row. Today, the Department of Public Health reported nearly 20,000 new cases. The previous high was reported just yesterday with more than 13,000 new cases reported. In South Carolina, DHEC reports around 3,300 new cases in the Palmetto State today. You can see that's almost 1,000 more compared to the numbers just reported on Christmas Eve. The climb in cases is causing University Hospital to make changes to its visitors policy. Here's what the hospital says you need to know. All visitors must be 18 or older and wear a mask at all times. Inpatient visitation is now limited to one visitor per patient per day from noon until 6 p.m. We're told laboring mothers and parents with children in the neonatal ICU should get guidance from their caregivers. And prompt care locations and emergency department will now only test you for COVID if you're showing symptoms. There are also a couple of visitor policy changes to know about at Augusta University Medical Center. The family presence policy is now one support person in the medical center and two support people for women's services and the children's hospital. AU Health is also only testing asymptomatic patients. Keep in mind, health officials and lawmakers across the two-state are urging you not to use hospitals' emergency department to get tested. Georgia Governor Brian Kemp just speaking in the last few hours about the concern as resources and staff start to stretch thin.
Obviously, if people are sick, they're not feeling well. If that is their only option, they absolutely need to go to the emergency room. But if people are just simply needing a test, with the amount of hospital staff that's now getting this very rapidly spreading virus, they can't work. They're short staffed as is with the increased volume that they had prior to the COVID numbers popping back up.
Governor Kemp says his team expects those challenges at hospitals to continue over the next 2 to 3 weeks. Here's News 12's Kennedy Harris now with local doctors, or with how local doctors say you can help and why they say this spike in cases is different from the first.
Well, things are changing day by day, and even though we've seen several surges throughout this pandemic, doctors say the increase in cases they're seeing now is happening at a much faster pace than it ever has before.
It seems like a bad instance of deja vu.
We have more than doubled our inpatient census in the last week, and that's probably been the fastest rise that we've seen throughout the pandemic.
Testing sites are full, cases are rising, and hospital ERs are crowded.
We certainly expected a bit of a bump after Christmas. This one hit even sooner afterwards than I think most of us expected.
University Hospital has tested more than 400 positive COVID tests in just the last few days, and they're up to 65 COVID patients in-house.
What we're seeing here locally, in your opinion, is this Delta or is this Omicron?
I think we're seeing both.
Dr. Jenkins says the influx of people seeking tests and testing positive could be related to people just being cautious after holiday gatherings. That was predictable.
Christmas parties that didn't happen a year ago happened this year.
But the speed at which cases are rising was not.
And so I'm a little reluctant to be as optimistic now with the rapid increase in positive cases that we've seen.
Even though most of the recent cases seem to be mild symptoms, University has gone from 1 back to 4 COVID units again.
And so I think we're looking at least a few more weeks of a rise in cases before we can think about being at the peak.
And doctors are urging you not to go to the emergency room just to get a COVID test. Go to a prompt care or another testing site. You will not be seen or tested any faster if you go to the emergency room. Reporting in Evans, Kennedy Harris, on your side.
And we just heard from Georgia Governor Brian Kemp and expect to hear more when he's in Augusta tomorrow to talk about the new hub downtown. It's bringing a brand new Boys and Girls Club headquarters and an outreach center to house local nonprofits. It's part of a $10 million investment into the Laney Walker and Harrisburg neighborhoods. We're expecting the governor to talk more about that the next phase of the project has in store. Well, coming up on News 12 at 6 o'clock, the people have spoken. We have